So first, I want to start off with saying to the essential workers, as always, thank you for what you're doing and being the backbone of the community to everyone. But I have some sad news to share. We have 11 new deaths we have to report. But what has happened, these 11 deaths, all in a private nursing home, were in late April or earlier this month, that had been reported to the state, but not have been reported to the county Department of Health. So we were just only aware of this the other day. So it brings our number from 76 to 87. This would not have affected our matrix getting into phase 1. It will not affect the matrix getting into phase 2. But despite that, it doesn't change the fact that there's still 11 more people who lost their lives and 11 more families that have been devastated. My condolences and prayers go out to the 11 families and to the 76 other families, as always. And just to give their dates, because I think it's the right thing to do. We had a female in her 90s pass away April 29th. 2 females on May 2nd, one in their 70s, one in their 80s. On May 3rd, we had 2 females in their 80s and one in their 90s for 3. On May 4th, we had 2 females in their 90s pass away. On May 6th, we had 1 female in their 80s pass away. And May 8th, we had 1 male in his 70s pass away. And May 9th, we had 1 male in his 80s pass away, for a total of 11. To the families, my condolences and prayers to you, to all the families, to the 76 other families. And I know it's a difficult time, and just want to let you know that Albany County is thinking about you, and we're here for you. As of today, we have 1,665 positive cases of the coronavirus. That's up 21 from yesterday. 5 out of the 21 were nursing home people that got tested, workers, essential workers at our nursing homes, which they're all essential, actually. 5 of them came out of that. We have 615 people under mandatory quarantine. The good news there is we have 233 people down from yesterday that came off of mandatory quarantine. We're still the same at 7 people under precautionary quarantine, so that hasn't changed. And we have 82 people that recovered from the numbers that we had, so which is good news too. There are now 29 people hospitalized. That's up 2 from yesterday, so that changed our hospitalization rate to 1.74%, which is up from 1.64, which that's the number under the matrix we watch in the hospitals every day. And we still have 3 people, which is the same currently in the ICU as that we had yesterday. And our 5-day average, which yesterday I told everyone was 5, today because of a little bit of the uptick is 8. So that changes our average a little bit. And again, I say to everyone, I urge you to go get tested. We made the mobile testing sites available, the colony at Rite Aid, the Priority 1 in Gilliland. You have the essential workers at UAlbany. You have the drive-thru at UAlbany. You're starting to see more and more doctors' offices get online for the testing and everything else. So please, take advantage of that. And as always, the number is area code 518-465-4771, area code 518-465-4771 for our mobile testing. At UAlbany is 1-888-364-3065, or as always, you can go online. And for Priority 1 Urgent Care in Gilliland, you can go online or you can call the number. Again, we need you to come out. And the mobile testing sites, we're reaching out to the churches and a variety of community stakeholders to make this happen, to get more people tested. And now it's the point in time that we're going to be changing up some things, so I'll be making announcements in the next couple of days of what we're going to be doing with the mobile testing. But I do want to say May is Older American Month, and every day I talk about our most precious population. That's our seniors. They're the ones been our backbone of our community. They're the ones that raised their families or paid their taxes and gave back, and now it's our time to give back. But most of them right now are scared. We have over 65,000 seniors over the age of 60 living longer, staying home, that depend on different services, depend on people checking on them. The congregate meal sites that we used to run, it was more of a health check for these seniors, but more if it was a time for them to get out and meet other seniors and have the opportunity just to have a conversation. Meals on Wheels, when we drop food off. The other opportunity is for people to check on these seniors and just to see how they're doing and different services we provide. So I thought it'd be great to have Deb Bertano come in, our Director of Department of Aging, to talk about some of the programs. But one of the things I want to bring to people's attention, as you see numbers going out there, we provided 75,901 home delivered meals, not including emergency meals to our seniors since this started. 75,000, huge number. And considering we've been into this almost 12 weeks, tomorrow will be 12 weeks we're into this, and 76 days later. So to Deb and the team, thank you. That's over 2,500 meals a day. I mean, so it's great work that they're doing. So I asked our commissioner to come in to talk about seniors, their struggles that they're having, and not to put you on the spot, some of the anxiety that you're having. So I am going to actually put you on the spot, so I do apologize for that, but I really don't. So I want to say, please talk about your experience, how you're feeling, and how the seniors are that you're dealing with.
Well, thank you, County Executive McCoy. Thank you to you and to Dr. Whalen for the many hours that you have put in and just all the hours that you're working to keep us safe. And that is comforting to us who are seniors. I am a senior. I'll be 71 soon. And at 71, I learned really how fragile we are, that a sub-microscopic particle could just turn our world upside down and make us feel isolated. I keep saying today is my coming out party because I've been home, working from home for weeks now. And I know what that isolation feels like. And I feel isolated, and I have 6 children. So you can imagine people who don't have something, how they might be feeling. But you do feel disconnected. You do feel disconnected from the world, and you actually can't wait to get to the TV to see what the numbers are, to see what's happening. And I am not the only senior who feels that way. We've been taking lots of calls, doing welfare checks. We talk to seniors. I talk to seniors all day and into the night who are struggling, who just want a welfare check, just want to know, will you call me each day just so that somebody answers the phone, so that I know that. And we're very happy to do that. I've got a great staff who is on that, and we call every day. What's happened with all of this in the business part of our lives is that we've really learned how to become more resourceful. That is, being able to work from home, and it is being able to take a model that we had, which was congregate meals that suddenly closed, social adult daycare for our seniors who had a place to go every day to interact. Suddenly that closed on them. And then we were able to, with the help of New York State Office for Aging, to turn all of that in to home-delivered meals and being able to do grab-and-go meals. I would be neglectful if I didn't thank our collaborations with our partners, with DSS, with New York Connects, Colony Senior Services, LifePath, Ravenna Senior Projects, Peter Young Industries, Green Island Senior Center, and our newest collaboration, Jewish Family Services, with our Kosher and Halal Express that's been delivering meals as well. All of these people have also done grocery shopping. They've also picked up prescriptions for our seniors. All of these things make a difference, and it's really what makes Albany County stand out, I think, among other counties. As we talked about, May is Older Americans Month, and Albany County, and ISOFA has a huge event that they do for seniors every year. Like high school graduations and weddings that had to be postponed, this celebration too will be postponed. But I would like to tell you who our honorees are, and we'll celebrate at a future time. And that is Joan Lipscomb, And we are thrilled to honor Joan Lipscomb. She's very active in the county, very active in the faith community, and an educator, and we're happy to honor her. I'm also very honored and happy to tell you that Jerry Sykes, the owner of Party Warehouse, is our other honoree. Jerry has many, if you own a nonprofit, everybody knows Jerry. Because it's through the generosity of their spirit, Joan as well, their time and their talent, that they've given back to this county and to so many people. So we are really delighted to have these two folks as our honorees. Also, I'd like to remind all the seniors who are watching that it's going to be another extremely warm day, and one of the things we've been talking about is staying hydrated. So we want you to stay hydrated. We urge you to stay in, stay hydrated, and stay cool the best that you can. My staff is, as I said, doing welfare checks. We love talking to the seniors. I mean, we love to provide our programs, but we love to have the interaction. So we're only a phone call away. We urge you to call us at 518-447-7198. And we would love to be able to talk to you. And we want to hear from you. We want to hear what your COVID-19 stories are as well, so that we can all kind of share in this, because as county executive has said right along, we are in this together. And I thank you very much for inviting me down and getting me out of the house.
Well, I'm glad it only took 12 weeks to get you out of the house, but I'm glad you're doing the right thing and staying home. And that's an important thing. When I was talking to Deb about this, I'm going to share a little bit of the story, is that she didn't want to leave her house. And that's like a lot of seniors. And like I said, we have over 65,000 seniors over the age of 60 that are living home. And that means, you know, thank goodness Deb has her family around her, so it's a little bit different. But you look at some seniors that don't have that, don't have people checking on them, or, you know, they don't have family that's around the area. They're isolated. And again, the world's changed. Everything's changed out there. And now you have to come out. And Deb, you probably had a different outlook when you came out of your house after 12 weeks and started driving down here going, hey, things are different. You know, and things are going to be different in the work area and how we deal with stuff going forward. So thank you for that. I got to put my mother-in-law in there. She's 78. And my mom, who's 85. So I think I should have you check on them.
Your mother-in-law is 78?
Yes.
That means I could be your mother?
Anyway,
Yeah.
So we'll move on from that. Liza, do you have anything to add?
I just have a quick thing to say, two quick things. First of all, in terms of the additional numbers reported this morning, I just wanted to state, you know, how difficult sometimes the numbers are. When you're reporting data in a real-time manner, it involves a lot of necessity of looking at the data, cleaning the data, making sure the data is accurate, and this takes time. So with any real-time data reporting, there are always going to be discrepancies, and there are going to be procedural things that need to be rectified as well. In this current situation, to be clear, the nursing home reported the deaths as they were mandated to do to the state health department. So these were not unreported deaths. They were just not deaths that the county was made aware of. So now we realize that there are systems that we need to put in place that are not currently, that had not been consistently put in place, so that we can rectify all those numbers. The cases themselves, we pull off the lab as they are reported. So that is a little bit easier for us as we pull cases off all the labs that have been reported in Albany County. We get those numbers. And then, of course, there's a real-time scrub of those individuals to determine, because sometimes a case may be reported as an Albany case, but when we reach out to the case, they may say, well, actually, here's my address, I live in Schenectady. It may initially show up as an Albany case and then be moved to a Schenectady County case. So this is an incredibly dynamic process, and I know sometimes people are concerned about the numbers, looking at our numbers, looking at the state numbers. I just think that we need to make a comment about the complexity of real-time data gathering and how this is a dynamic process, and there are some of these data points that we are actively working on so that we can give you the most accurate data. The second thing that I wanted to mention was just a state initiative that has been launched between today and Saturday to do antibody testing on grocery store workers. We know that our grocery store workers are our frontline workers who are exposed frequently and for prolonged periods of time to members of the public. They are at high risk. We have talked before about them getting tested for COVID through the PCR test, which is a test that can be done to determine if you have the virus. But this is an antibody testing pilot that's being done throughout the state, and it is being done at CEFCU arena, and it is between 10:30 and 3 in Albany today, tomorrow, and Saturday. So I think that information has been posted on our website.
Yeah, no, I have it on there. I was
Yep.
just gonna, actually, you got it out before I could
Oh,
say it. But no, I
okay.
appreciate that, doctor.
So yeah, I just, this is important too. Antibody testing does not indicate that you actually have active COVID, but may indicate that you were exposed and that you have developed antibodies. So you likely had the disease in the past, and as we know, people aren't always symptomatic. So it's an important data piece, and I encourage people to go and get that completely free testing done.
Thank you. No, thank you. It is on our website, so you can get the times and locations and how to register for that. So I want to just say just a couple things before we end. We had some special guests that arrived with signs to encourage our residents with gift cards for the staff and coffee and ice cream. So I want to thank everyone who went up to our Shaker Place Nursing Home with that. They raised money to do this. We have a list of them who did raise money and paid for it out of their own pockets. These are people who provided us long-term care services who wanted to show their support. So thank you so much. And you can see their name on the screen. I also want to remind you that you can also use our mental health hotline number 7 days a week, 8 a.m. to 8 p.m. And the number, as always, is area code 518-269-6634. And our 24-hour sexual assault hotline number, area code 518-447-7716, as always, and the 211 in the New York State hotline. And again, I do want to remind everyone, it's been 8 days since we had someone pass away in the county, so which is good. And tomorrow I'll be briefing a lot on phase 2 from the meetings I've been having in the control rooms at 1400 hours, and to talk about how we're going to look like if everything continues to go the right way. Wednesday, June 3rd, where what would start to open up, and what the next phase is going to look like. So I'll be briefing tomorrow on that once I get a little bit more guidance from our control room.